Hello, everyone, and welcome to our session on cervical screening for newcomer women. Today, we have some incredible nursing students from our UNB nursing faculty. They have partnered with us to have a series of women's health presentations. So I'd like to introduce Melanie, Shania, and Michaela, who will be taking you through your cervical screening information session.
All right, thank you, Holly. So before we get started, we just want to ask everyone to complete the survey, and we invite you to take a couple of minutes to complete this anonymous survey. There are 2 questions to answer. One question asks how much you know about cervical screening already, while the other asks how willing you are to access cervical screening services right now. And it is okay if you do not know about cervical screening, because we're going to be covering a lot on this topic tonight. The purpose of the survey is for us to understand how much you've learned during your time with us tonight, and how willing you may be to access cervical screening services in the future. So just a little bit of an introduction to cervical cancer. Just for a moment, I want everyone to take a moment and reflect on whether or not you've heard of cervical cancer. If you have heard of cervical cancer before, have you ever heard of cervical screening? If you have not heard of it before, that's okay. Like I said, we're going to be covering a lot of information on this topic tonight. However, before we get started, I think there is great value in understanding why the topic of cervical cancer is important. Cervical cancer is the 4th most common type of cancer that occurs in women. In 2018, the World Health Organization said that 570,000 women from around the world are diagnosed with cervical cancer, and approximately 311,000 of these women will die. So if we just think a little bit about the image on the screen here under global impact, that's how 1 in 2 women approximately will die of cervical cancer that are diagnosed with it. Although this is a global health problem, it affects Canada too. The Canadian Cancer Society estimated that 1,350 women will be diagnosed with cervical cancer this year. And of these 1,350 women, it is estimated that approximately 410 will die. No woman should have to die of cervical cancer, and you have the potential to save your life with cervical screening. So you may be wondering right now at this point in the presentation, so cervical cancer affects many people, but what is the cervix? So the cervix is the lower part of your uterus, and the uterus is an organ in the woman's body that allows her to carry a baby during pregnancy. It forms the passageway between the vagina and the uterus. It is a very important part of your reproductive system because it protects your internal reproductive organs, like your uterus or your ovaries, like you can see in the picture. And it does this by secreting a thick mucus-like substance that acts like a barrier for viruses and bacteria, and it prevents those from entering into the uterus. Just a fun fact, during pregnancy, the cervix also helps to keep the baby inside your body until he or she is ready to be born. And when the baby is ready to be born, it actually dilates or becomes sort of like a big hole that's about the size of a bagel that lets the baby to pass through and enter the world. The cervix is truly an incredible part of the female anatomy. Okay, so now that we've talked a little bit more about what a cervix is, let's talk a little bit about cervical cancer. So to start out more broadly, cancer is a disease that causes your cells to grow abnormally and out of control. Normally, our body is able to detect abnormal cells and get rid of them before they become problematic. However, cancer cells are able to disguise themselves in such a way that our body is just not able to recognize them as being abnormal. These cancerous cells often grow into masses, and these masses are called tumors. They are unable to function as regular tissue. So the tumors steal the blood and nutrients from your body, decreasing the amount that can actually go to healthy tissues. If it becomes severe enough, the cancerous cells can spread to other places in the body. So in healthcare, we like to name cancers based on where they originate in the body. So we can see here that cervical cancer is cancer that originated or started in the cervix. So now we're going to move on to talk a little bit more about precancerous cells. So it's really important to note that it is possible to have cells in the body that appear abnormal under a microscope, but these ones will not be growing out of control. And it is possible that these cells could go unrecognized by our body's defense system and become cancerous in the future. And these cells, when they become cancerous, like we've talked about before, grow out of control and wreak havoc on your body. So this is kind of where cervical screening comes in handy, such that doctors or nurse practitioners are able to find these abnormal cells and provide treatment before they have the chance to become cancerous cells. So if we look here on the screen, we can see 3 slides. So when someone has cervical screening or a Pap smear done, this is what the cells look like under the microscope. We can see the left photo, or the photo that's called normal. These are normal cervical cells. There is nothing wrong with them. And if we move over to precancerous cells, they start to look a little bit different, such that they're smaller and they're more clumped together. And lastly, on the cancerous slide, we can see that the cells are really, really misshapen and are numerous and are clumped together in a really abnormal way. So when a healthcare professional performs their Pap smear, they will send these tiny little cells to the lab to be tested. And the lab will tell the doctor or nurse practitioner what they see. From here, the doctor or nurse practitioner can either form a diagnosis of cancer or either precancerous cells, or tell the patient that their test results are normal and indicate when they should come back for their next Pap smear.
So now that we've talked a little bit about cervical cancer, I'm going to talk some more about what cervical screening really is. So cervical cancer is a very serious but preventable disease. The key is to find it early so that it can be treated before it becomes serious. The earlier cervical cancer is detected or found using cervical screening procedures, the less likely you are to die from this disease. In other words, finding cervical cancer earlier means you're more likely to survive and make a full recovery if you are diagnosed with it. Cervical screening is done with something called a Pap test. The Pap test is what allows your healthcare provider to find any abnormal cells in your cervix. These abnormal cells are what could possibly or could potentially become cervical cancer. So they are what needs to be treated as early as possible. By treating these abnormal cells nice and early, we can stop cervical cancer before it gets a chance to develop. I'll explain more about what a Pap test looks like soon. So we can go to the next slide there. So cervical screening is recommended in New Brunswick for all women between the ages of 21 and 29 who have ever been sexually active. So what this means is that you should go for a Pap test either when you turn 21 or about 2 years after you become sexually active, whichever comes last. So if you are 23 but have never had any sort of sexual activity, you would not need to have cervical screening done until 2 years after the first time you have sex. However, if you become sexually active when you're, say, 18 or 19 years old, you should go get a Pap test done when you turn 21. If you aren't sure whether or not you should go have a cervical screening done, you can book an appointment with your primary care provider, like your family doctor, or at a walk-in clinic to ask for more information. So even though cervical screening is recommended for people who are sexually active, it is not a sexual procedure. It is an important diagnostic test that is used to make sure you are healthy. Going for a Pap test is just like going for blood work or an X-ray. It gives your doctor the information they need to keep you as healthy as possible. It's very important for women of all ages, even after you stop having your period, which is called menopause. So here we have some examples of a letter you might receive from the government of New Brunswick. It's in both English and French. These letters are kind of a signal that you need to go for a Pap test, either if you haven't had one yet, or if you're late and should have gone for one. We'll talk about more what you should do if you receive one of these letters later on in the presentation. So once you know you are someone who should go for a Pap test or have cervical screening done, it's important that you go every 3 years. Like I explained earlier, New Brunswick will send you a letter to let you know if you need to get one done or if you're late booking your appointment. Going for a Pap test every 3 years can help decrease your chances of developing cervical cancer by 70%. That means you're 70% less likely to get cervical cancer if you go for a Pap test every 3 years. Since a Pap test can find the abnormal cells in your cervix before they have the chance to become cancer, you have an 85% chance of making a full recovery from cervical cancer that's caught in the early stages. The earlier we're able to find your potential cancer cells, the sooner we can treat them and the more likely you are to get better. As you can see, cervical screening has a lot of great benefits for your health. That being said, it is ultimately your choice whether or not to go for this procedure because it is your body. We just want you all to be aware of your options here in Fredericton. So I'm just going to quickly explain what you can expect to see at your appointment if you do decide to go for a cervical screening or a Pap test. So before your exam, the doctor will talk to you and ask you some questions about your health. Some of these questions might be personal, including questions about your sexual activity. It's normal to feel a little bit embarrassed, but you should try your best to relax and know that your doctor has your best interests at heart. It's also important to know that you can request that your doctor or nurse practitioner who's doing this test, you can request for them to be female so that you feel more comfortable. So after asking you some questions, the doctor will explain the different parts of the exam. They'll talk you through the whole thing. And again, you can ask more questions if you don't know what to expect or if you feel nervous. And if you do feel nervous, make sure you tell your healthcare provider because they'll be able to help you relax. So after the talking part of your appointment, you'll then be asked to undress from the waist down. After you undress, you'll be given something such as a gown or a drape to cover yourself with. After that, they'll ask you to lie down on the exam table. They'll ask you to scoot down, kind of down to the edge of the table and put your legs in the stirrups, which are just the holders for your feet so that they can get your legs in a good position to see everything. So whenever you're ready and you're relaxed, your doctor will talk you through the whole thing. The healthcare provider will gently insert an instrument called a speculum into your vagina so that they can see your cervix. And then they'll use a small little brush like the one you see here to collect some cells from your cervix. So these cells that are collected will be sent to a lab, and the lab is what will examine them, and they'll look for any of those abnormalities. If your results are abnormal, the person who did your Pap test will contact you. But if they're normal and you have nothing to worry about, then you probably won't hear anything back. So I just want to mention that during a procedure like this, doctor-patient confidentiality is very important. So that means anything you share with the person who's doing your test won't be told to anybody else. They're going to keep all of your information private. And again, you can request a female practitioner to do your test so that you feel more comfortable. We also have a quick video for you on the next slide here that'll show you more visually what you can expect at your appointment.
Screening for cervical cancer, Pap Test. A Pap test can find abnormal cells on your cervix before they turn into cancer. By finding and treating these cells early, it's possible to stop cancer from developing. If you're a woman between the ages of 25 and 69, you should have regular Pap tests. You should have a Pap test every 3 years. The test is free and only takes a few minutes of your time. Your Pap can be done by a doctor or healthcare provider at their office or clinic. For a Pap test, you will need to undress from the waist down. You will be provided with a gown or sheet to cover up. Then lie back on the medical table and put your feet up. When you're comfortable, the doctor will gently insert an instrument called a speculum into your vagina. Next, the doctor will use a small spatula or brush to collect some cells from your cervix. You may feel a little discomfort, but the procedure should not be painful. The sample then goes to a lab to be examined. Your results will be sent to your doctor. If there are any abnormal cells present, your doctor will contact you. An abnormal result does not mean that you have cancer. However, it is very important to attend all follow-up appointments. Remember, detecting and treating abnormal cells can stop cancer from developing. By having this test every 3 years, as recommended by the BC Cancer Agency, you can reduce your risk of developing cervical cancer by up to 70%. To get a Pap test, call your doctor or find a suitable clinic by visiting our website at screeningbc.ca.
So that video was from British Columbia. So the information on when or who should go for a Pap test is a little bit different, but everything else is the same here in New Brunswick. So like the video mentioned, if your results of your test do come back as abnormal, it doesn't always mean cancer. If these results come back as abnormal, it can mean many things. The main purpose of a Pap test is to find cervical cancer early, but abnormal results can tell your doctor a lot of different things about what's going on in your body. It could mean that you have an infection in your lower reproductive tract, which includes your cervix and vagina. It may mean you have something like a polyp or a cyst growing in your cervix, which is not cancerous. Or you could have some cells that have changed, but will be able to go back to normal on their own. However, abnormal results from a Pap test could also mean that the doctor has found cancer or cells that are precancerous. Precancerous cells, like Shania mentioned earlier, can become cancer if they are left untreated. But if they're found and treated early enough, we can stop precancerous cells from becoming cancer. So if abnormalities are found, so if your results come back as abnormal, what happens next really depends on how serious the results are. Like I mentioned earlier, sometimes your cells can change to become abnormal on their own, but they'll be able to go back to normal without any treatment. In this situation, you wouldn't need treatment because the cells go back to normal on their own, like I already said. If your Pap test results find precancerous cells, they would be treated to stop them from developing into cancer. What that treatment looks like depends on how far along they are and a lot of other factors, but your healthcare provider will know what to do next. The earlier these precancerous cells are caught, the better chance you have of making a full recovery from cervical cancer. Sometimes the doctor may not be sure of the reason for an abnormal result. So in this situation, more tests need to be done to figure out why your results came back as abnormal. These tests could include a second Pap test, a biopsy, which is when they take a bigger piece of wherever the abnormal cells are, so they can look at it more closely and figure out what the reason is for your abnormal result. Or you may be asked to do an HPV test. This is because HPV, which is also called human papillomavirus, is the most common cause of changes to cervical cells.
So some things that might get in the way or cause difficulty to accessing cervical screening are shown on this slide. So these are some things that could make it difficult, and then some ideas to work through them. So sometimes you might not be sure how to make an appointment or need help to make an appointment. And there are people at the Multicultural Association that can help you do that. Transportation is sometimes another challenge people face. So most of the cervical screening locations in Fredericton can be accessed by public transportation, like the bus, Fredericton City Transit, or a taxi. We've included a link on this slide to the schedules for the Fredericton City Transit. Childcare can be another difficulty, and short-term childcare services can be accessed through a friend or a family member sometimes. Or if you're comfortable, you can even bring your child with you to the appointment. You could consider booking your appointment during school hours if you have school-aged children. There is no cost for cervical screening. It's covered by Medicare. You do not need to pay for your appointment or any of the services provided. Timing can be a challenge as well. Sometimes you might worry about getting time off work. Most of the time, appointments can be made in advance because oftentimes there are wait times to see a practitioner. This can provide some flexibility when booking time off work or school. Most employers are considerate of health-related appointments, and you don't need to tell your employer where or why you are going to see the health practitioner. That leads into privacy and confidentiality. Personal health information is kept confidential and private by all healthcare professionals. This information will not be shared with any family members or the public in any way. If a person doesn't have a family care provider, they can still access cervical screening services through the Fredericton Downtown Community Health Clinic or other facilities in the city and province that we'll talk about later. Sometimes you might be anxious or scared of the procedure. Medical procedures can seem scary for anyone, and this is normal. Education about what to expect with cervical screening can help prepare people by giving them a sense of what will happen. Talking to or bringing a trusted friend to the appointment can help patients feel more supported. Other times, religious or cultural beliefs and values can be something that's difficult to overcome. We respectfully acknowledge that in some cultures and religions, it may not be acceptable to talk about parts of the body that are generally associated with sexuality or reproductive health. It is okay to maintain these beliefs and values, and it is also important to have the information that in the Canadian healthcare system, cervical screening is an important and regular healthcare practice to maintain overall health. And you can go to the next slide. So keeping reproductive organs healthy is very important, and the best way to prevent cervical cancer is through regular Pap testing. These tests can detect abnormal cells on the cervix, like was said before, and the sooner it's detected, the better chance of treating it. So it can also detect HPV, which is human papillomavirus, and other abnormalities. Some strains of this virus can cause cervical cancer, and Pap testing can help find these. You can go to the next slide. So there is a vaccination for HPV. It's called Gardasil. It is approved in New Brunswick for girls and women aged 9 to age 45. And in New Brunswick, there's a school-based immunization program for girls that starts in grade 7. 2 doses of the vaccination are needed. A parent's consent is also needed for youth under 16 years of age, and there's no cost to receiving the vaccine through this program. So this vaccine protects against 7 types of HPV that can cause up to 90% of cervical cancers. Another way to reduce the risk is through regular sexually transmitted infection screening. It's recommended every 1 to 2 years. This could help find any infections that may or may not have symptoms, but could eventually make a woman sick or unable to have children. Also, limiting sexual partners and using condoms during intercourse can help reduce the risk of getting HPV and other STIs, sexually transmitted infections, which could increase the risk of cervical and reproductive organ cancers. Self-care and self-checks are another way to stay healthy. So having regular health exams with your primary care physician or nurse practitioner can help identify and prevent risk factors in your health history and promote better health. Another way is not smoking and limiting alcohol. So when a person smokes or drinks alcohol regularly, your body is less likely to fight off an infection as someone who doesn't smoke or drink alcohol regularly. Eating a healthy diet provides a person's body with the nutrition they need to help fight infections. Limiting processed foods and including fresh vegetables, proteins such as legumes, nuts, and eggs, and whole grain foods are recommended. Women can also perform self-breast exams to feel for abnormal or new lumps or swelling in the breast tissue. Your healthcare provider can show you how this is done. So how do you get a Pap test? As part of New Brunswick's cervical cancer prevention and screening program, women eligible for cervical screening ages 21 to 69 will receive the letter that Michaela showed earlier, inviting or reminding them to get a Pap test done. If you have a primary care provider, they will also get the letter. You can call your primary care provider to book an appointment, or if you don't have one, you can contact any of the locations we will discuss in the next few slides. Also, at the bottom of this slide, there's a link to all of the Pap test sites in New Brunswick. So, cervical screening services in Fredericton. Like I said, most family doctors and nurse practitioners can do cervical screening in their office. If you don't have a family doctor, there is a link that you can access called Patient Connect, and it can put you in touch with a family doctor. You can call or go online. So you can call 811 right now. Because of the COVID-19 pandemic, registration can only be done online. And if you click the link on this slide where it says Patient Connect 811, that will take you to the website. The Fredericton Downtown Community Health Center on Fredericton's south side offers access to practitioners who are women in partnership with UNB Nursing who can offer cervical screening services and other reproductive health services. The contact information to make an appointment can be found on this slide. And shown here, this is the Gibson Health Center. It's located on Fredericton's north side. And here you can access cervical screening through a nurse practitioner or doctor. And the contact information to make an appointment is on this slide.
So now, we think it is really important for us to share factual information with you so that you are able to make an informed decision about your body. We also recognize that it is equally as meaningful for you to hear from stories from real women from around the world. In our upcoming slides, you will hear the stories of 3 women, Lakshmi from India, Harinder from Canada, and Rambidze from Zimbabwe. These women recount the stories of their experience with cervical screening and how it saved their lives.
मेरा नाम लक्ष्मी है जी, रजौकरी की मैं रहने वाली हूँ। मेरे परिवार में जी मेरे 2 बेटी हैं, 2 मेरे बेटा हैं, मेरा पति है। भैंस पाल के मैं उनसे ही अपना दूध दाद बेच के मैं अपना गुजारा करती थी। हमारे रजौकरी गांव में कोई चीज़ की सुविधा नहीं है जी। हमको बहुत दूर इलाज कराने के लिए हम जाते हैं, हमको बहुत दिक्कत पड़ती है जी। यहाँ पे कैंप लगा था, गाड़ी आई है, आप फ्री में इलाज हो रहा है, टेस्ट हो रहा है फ्री में। तो मुझे भी पता चली तो मैं भी दौड़ के गई। मैंने जाके मैम दिखाया तो मेरा टेस्ट करा कि मेरे बीमारी बता दी कि आपके तो कोई कैंसर वगैरह भी हो सकती है, आपके शरीर के अंदर बीमारी है। तो मैं भी शर्म मारी थी कि मैं तो ऐसा नहीं करवाऊं। लड़की बोली मेरी कि मम्मी आपके लिए तो इलाज कराना बहुत ज़रूरी है, क्यों घर की गृहस्थी आपके बगैर हम कैसा अपना समय काटेंगे, आप इलाज करवाओ। फिर मैं सूदी हुई पे सफदरजंग मेडिकल पे गई थी। 5-6 डॉक्टर ने मेरा जांच करा था, उनने मेरा दिक्कत बताई। हम आपको इलाज पूरा कराएंगे, इसमें ज़्यादा समय नहीं लगती, टाइम से इलाज करा लेंगे, टाइम से चेकअप करा लेंगे तो हमारे कोई परेशानी दिक्कत नहीं पड़ेगी। अब मैंने अपना इलाज करा लिया तो मैं पूरा काम अपने घर की गृहस्थी संभालती हूँ। तो ये कैंप लगना इतना ज़रूरी है, जिसी माई बहनी के दिक्कत है तो इन्हीं कैंप लगने पे जो भी नहीं अपना टेस्ट करा रही है वो भी करा रही है। डर मैं भी थी और शर्म मुझको भी लगेगी, लेकिन अब आप शर्म करोगी, थोड़ा डर करोगी तो अपना इलाज करवा नहीं पाओगी। इलाज करवाना बहुत ज़रूरी है, और इलाज नहीं कराओगे तो आपकी जान भी जाएगी। आपको अंदर थोड़ी बीमारी है उसको ज़्यादा भी फैलेगी। शर्म की जगह शर्म करो, लेकिन बीमारी के अंदर कोई शर्म मत करो।
So now we're going to see a story told by Harinder, who's from Canada.
I was a busy mother of 2 kids. I had my husband who was working and I was working part-time. It was changing one diaper after the next, dropping the kids off at daycare, going to work. It was hectic. I thought I'm a healthy young woman and there was nothing wrong with me. I played sports, I walked, I jogged, I went to the gym, and I kind of took my health for granted. When I went to get my Pap test done, I didn't think anything of it. It didn't cross my mind until 6 weeks later when I got that phone call. When I heard I had a precancerous condition, I was pretty scared. When you hear the word cancer, you think, oh, how long do I have to live? Like 6 months, a year? My kids, they were 1.5 and 2.5. They didn't even know who I was at that time. And I'm like, these kids are never gonna know who I am if I have cancer and if I'm gonna die. And I thought, this can't happen to me. I saw the doctor and he told me that, hey, this is good that we caught this now, that this is not a big deal. It's something that you could cure if you don't get yourself checked. The precancerous cells can grow and become cancer one day. And before you know it, it'll be too late. My family's the center of my universe. My girls, I have them, and I have my husband. Visiting my grandma on her farm and seeing my parents. Family is important. It's number one. I enjoy life every single day. I enjoy doing yoga. I spend time with my kids, watching them practice basketball. We go to Mexico every Christmas. I spend every moment just having fun. Life is happy for me. I think it's important for women to put aside their anxiety and get their Pap test done because it's something that's gonna possibly save their life. It's gonna catch that silent killer that sometimes is lurking there. Getting regular Pap tests can help prevent cervical cancer. I encourage every woman to get screened on a regular basis. I honestly believe the Pap test saved my life.
Okay, so now we're going to hear from Rumbidze from Zimbabwe.
Zviri kuti umhanye uchiri kunzwa kuti ndinogona kuzvifambira kwete kuzonzi tsvagai ngoro tsvagai bhara. Ini zita rangu ndinonzi Rumbidzai Mushai. Vakanga vambotora kumadhokota kupi zvese vana mari ndobva vaishayiwa, saka vashayiwa kutodi vanga vatwano yekuti isusu hatichazi kutodi nokuti chanetsa imari. Pakwakutopererwa toshawa totangira papi. Vana vachiri vasati vanyatsokuva vanhu vane zvinhu zvakanti kutanga ngoti apo mumusi apo mumusi urega mwana wane mhuri haachakwanisi kuti ati mai manje ndovaita sei. Inini ndiripo vamweni vakura havachagona kuita chinhu vakatohwa nehama dzavo. Pandakazosvika kuna MCAF handiti pandakaisa chichemo changu kuti ndo dambudziko randinaro asi ndikuwara. Saka sister Miss Nobo wasongondi director tinofamba soso. Kusvikira pandakazonzi operation. Pandakangozodedzwa zita rangu kuti rumbidzai. Ndakasumuka ndega ndichinzwa asane yangu ichirama. Ndichinzwa kuti ini zvinizvi. Nyaya yemuviri wangu. Mwiri wangu ndiri kunzwa kuti manaka. Kubva pandakaitwa operation iko zvino. Mwiri wangu ndiri kunzwa kuti ndanaka kana kuti kushanda basa rangu. Ndakutoshanda basa rangu zvakasununguka. Handina pandakambonzwa kurwadziwa kuvata hupinda kutovata zvokuti pepuka kwaidza. Ndainende nyangwe kuti hembe nyangwe kuti zvese ndakadzimwe zvinhu ndakatorongedza. Hatichakwani nokutonzwa mwiri wangu tokasununguka.
All right. So now that you are aware of cervical screening, we invite you to participate in a second survey. This survey is also anonymous and consists of the same 2 questions that you answered prior to the start of the presentation. This survey will allow us to know how your understanding of cervical screening has changed and your willingness to access these services in the future. We appreciate your participation as it allows us to recognize whether this session was helpful for you. So with that, we want to thank you for joining us tonight and just open up the floor to any questions.